Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and today we will be diving into a practice question involving joint planes of motion. A 30-year-old patient presents with limited range of motion and pain in their right shoulder following a fall onto an outstretched hand. On examination, passive abduction of the shoulder is restricted, and there is tenderness over the acromioclavicular joint. Which plane of motion is primarily affected in this patient? Option A, sagittal plane. Option B, frontal plane. Option C, transverse plane. Or option D, the oblique plane. And remember, we are trying to determine which plane of motion is primarily affected when there is restrictions in passive abduction or abduction of the shoulder. All right, so the correct answer is option B. Now, the frontal plane is the correct answer choice for this question. And although I want to dive right into a rationale as to why the correct answer would be option B, the frontal plane, I want to first spend some time reviewing the various planes of motion, since it really is essential in understanding human movement and rehabilitation. Now, first, let's even define, what joint planes of motion are. When we're talking about joint planes of motion, we're referring to the specific ways in which our joints move. These movements occur in specific planes relative to the body's anatomical position. Now, the three main joint planes are the sagittal plane, the frontal plane, and the transverse plane. So first, let's review the sagittal plane. Now, let's imagine a vertical line. This is a vertical plane that divides the body into the left and right half. Now, movement in the sagittal plane occurs in the forward or backward direction, such as flexing the elbow or flexing the knee. Now, sagittal plane motions are best seen from the side or a lateral view. Next up, we have our frontal plane, which is what that option choice was for this question. Now, our frontal plane is a vertical plane, which divides the body into a front and a back half, or anterior and posterior half. Now, movements in the frontal plane occur in the side-to-side direction, such as shoulder abduction, like this question, or hip abduction, or adduction as well. Now, frontal plane motions are best seen from the front or the rear, or the anterior or posterior directions. And finally, we have our transverse plane. Now, this is a horizontal plane, which divides the body into an upper and a lower half, or a superior and an inferior half. Now, movements in the transverse plane occur with rotation, so such as rotating or twisting our head or our trunk. Now, understanding these planes of motion are crucial for physical therapists and physical therapy assistants because we are assessing and treating movement impairments and injuries. So by being able to identify which plane of motion is affected, therapists can then develop targeted rehabilitation programs to really restore function and mobility. So again, for this practice exam question, the correct answer was option B, our frontal plane, because that shoulder abduction was restricted. Now, thank you very much for listening. I really hope you found this episode discussing joint planes of motion beneficial. Now, we will also be linking some references to this episode and within our episode notes if you want to go back and review this topic in a little bit more detail. Warriors, never forget, you are powerful, you are strong, you are a final frontier warrior, and you will pass. For more information on the NPTE Final Frontier, please visit NPTEFF NPTEFF.com. You could also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok. Till next time, have a great day and a powerful tomorrow. Thank you for listening.